Hello everybody, welcome to Dr. Chan's Medical Ailments Forum today. The topic that I've chosen to talk about is nosebleed, what causes nosebleed and how to stop the nosebleed and when you should be concerned if you have a nosebleed. Number one thing is I have to apologize for the lighting, because if I have to wait for the sun to go down, I'll never get a chance to do this video, so apologies for these funny lights in front of my face. Now, the reason that I chose to talk about nosebleed is because several weeks ago I actually had a really bad nosebleed. It came out from both sides of the nostril and it was messy. It was just before I need to go out to work. So I thought it would be a good opportunity to talk about what causes nosebleed and how to deal with it, because quite a lot of the time when I talk to my patients, they tend to be doing the wrong thing. It's not their fault, it's just because different people said different things of how to stop the nosebleed. So let's get it right this time round. Okay, so generally speaking, nosebleed shouldn't be something too serious and it can be stopped properly by ourselves. It should not last more than 10 to 15 minutes if we do it right. So there are two main kinds of nosebleed. One is an anterior one. Anterior means forward, and posterior means backwards. So anterior bleeding means the bleeding is coming out from the front of your nose. Within our nose we've got nasal mucosas, which we have very dense small blood vessels covering them, and obviously these areas can get irritated, and sometimes if they're inflamed they bleed easily, especially in the structure inside our nose near the septum, which divide our nose into two parts. There's a structure called the Little's area, and these are the area that got a lot of blood vessels around and can bleed easily, especially when they get irritated. So let's say someone who suffers from hay fever, or someone has been having a blow to the nose, or needing to blow the nose a lot because of cold and flu, then that caused the area to be irritated and you bleed easily. These kind of cases are quite common and it can easily be sorted out. Generally speaking, it happens more to children than adults. But there we go, and it's easily sorted out. Whereas the posterior bleeding that we're talking about is bleeding at the back of your nose, which is in the nasopharynx, the area that you don't really see. And that is more serious, and it happens less likely in children when compared to adults. And as you can imagine, because it's really far back, it's generally harder to stop, and you might have to think about other condition that potentially causes the bleeding. For example, could that person be having some sort of trauma to the head, then later on had a bleed at the back of the nose? Or could that be some sort of blood clotting conditions? For example, if they're on warfarins or blood thinning medications, you need to be aware, especially in that kind of situations. So let's just talk about a common one, the anterior nosebleed. So let's say if you suddenly develop a nosebleed, what do you do? Now, I've heard people saying pinch the hard bit of your nose, which is there. Now, to be honest, that's not going to do anything at all, because that's the cartilage, and the bleeding that's normally come from the anterior nosebleed is coming from the soft bit. So the most important thing is, number one, stay calm, okay? Don't panic, because although you see a lot of blood coming out from your nose and you'll be like, oh, what to do, sit down first, because you don't want to have a massive nosebleed walking around. Your blood pressure might drop, especially if you're panicking, and you might injure yourself when you're walking around. So sit down and make sure you pinch the soft bit of your nose, which is just right there. Now, once you start pinching, I don't want you to keep checking every few minutes and see if it stopped bleeding, because that's kind of counterproductive. Most important thing is hold firmly on the area for about 10 to 15 minutes. Then you recheck the situation and see if you're bleeding. If the bleeding has gone down but still bleeding a little bit, there's no harm, go back to pinching a nose and check it periodically. Another thing that can help you is to make sure you keep your head down. Once again, when I was younger in school, some people said, oh, when you have a nosebleed, you need to pinch your nose and have your head tilted up. That's actually not good for you at all, because although when you do that, the blood doesn't come out from the front. But the bad thing is the blood trickle down to your throat, at the back of your throat, and causing clots to form at the back of your throat, and also can cause irritation, make you cough, and you might swallow the blood, etc. So most important thing is pinch your nose, sit down, and have your head down. and that's the safest way to do. If you have got someone else nearby that can help you, or if you can get to the fridge or the freezer easily, it's no harm putting an ice pack on your forehead or at the bridge of your nose to kind of just cool down the blood vessels around and try to slow down the blood flow a little bit. Now, things that you need to be concerned regarding nosebleed is if, number one, you feel unwell, especially if you're losing a lot of blood and you feel faint. Number two, if you're on medication that thin your blood, for example, you're on warfarin or a Klaxane injection to thin your blood, and the bleeding is not stopping, you need to be aware and you might need to call 999. Okay, and number three is if you've been doing the right thing, as I just mentioned earlier on, after 15 to 20 minutes, the bleeding is still ongoing, it's kind of worth contacting medical advice, especially if you're at home and you're worried. You might have to call 999 or 111 to see what to do, because obviously if bleeding is ongoing and you're on your own, that can be quite serious, and I think medical attention is needed. So the bottom line is, nosebleed is, you know, relatively common, and it can be easily sorted out at home, but you need to remember the several red flag signs that I just mentioned earlier on. If they do come up, you need to contact medical advice urgently. If you can contact your GP, that's great. If not, it depends on the hours. Let's say out of hours, you might consider calling 111 if you're from the UK, and if situation is severe and you feel unwell, you might need to call 999. So hopefully the information that I provided for you is useful, and you know, please don't hesitate to contact your GP if you've got further queries, especially if you've got blood clotting condition, or if you're on certain medication, as I mentioned earlier on. So until we meet next time, take care of yourself. Bye bye.